Hi, good afternoon. I'm Dr. Jason Weinstein. I'm a practicing orthopedic surgeon in Palm Beach County here in South Florida, and I'd like to welcome you to our MIPS webinar for orthopedic surgeons. I'm joined today by Ida Montashi, who is our Senior Product Manager for Compliance, and we're going to run through some PowerPoint slides today, as well as some live demonstrations to really give you a feel for what our product's about and how we can make your life easier with regards to MIPS. So for those of you who don't know, MIPS stands for Merit-Based Incentive Payment System. This is a modified fee for service, and essentially a lot of the components are very familiar to you. There's the components of PQRS, meaningful use, and the value-based modifier. One of the things that's important to remember is that this is not just a zero-sum game with MIPS. In 2017, physicians who achieve a score of 70 or more will split an earmarked $500 million. And this $500 million is earmarked every year for the next 5 years. So what does this look like in a diagram form? So you can see in 2019, there will be an upward or a downward adjustment of 4% based on your performance in 2017. Now that might not seem like a lot, but if you kind of translate that out to 2022, everything heightens to 9%, and so your adjustment could be upwards of 9% or it could be downwards of 9%. One other way to think of this is if you're in an orthopedic group and your overhead runs at around 50%, your payment cut will be around 20% on your Medicare payments. So what are the components of MIPS in 2017? So quality is the biggest component, and it's really the one that we're going to spend the most time talking about. That's 60%. Improvement activities are 15%. Advancing care, which many of you are familiar with, which has replaced meaningful use, is 25%. And cost is 0%. As we go on over the next few years, cost is going to become an increasingly bigger component of MIPS, and quality component is going to go down. So why is this important? Obviously, you want to get your upward adjustments and be an exceptional performer, but with increased transparency in healthcare, your numbers and your performance are going to be readily accessible to anybody who has access to the internet. If you go onto the website Physician Compare under Medicare.gov, you can look and see how you're doing. You can imagine that payers, insurance companies are going to find that information particularly important, and you might actually be able to leverage your payers if you can demonstrate that you are an exceptional performer. So there's my name, and apparently in 2015 I was a good performer for urinary incontinence for PQRS. So what about quality? We want to make your life easy with respect to quality. We want to make sure that you're documenting quickly and you can continue to be a doctor, but getting your quality points in the background. Really, as a testament to Modernizing Medicine, we did quite good in 2015, having about 2,850 providers to test. In 2016, we actually had almost 3,000 providers to test successfully for PQRS. So here's kind of a laundry list of tips for why we think it's important to really focus on this product in particular in regards to MIPS. So we have this beautiful user interface, which is essentially your MIPS dashboard. And Ida is going to kind of lay out how your score is calculated using this dashboard. So you can refer to this dashboard and look at each of these components in real time, day to day, and know where you are before you actually submit. Because obviously, if you're going to be submitting, you want to have the highest score possible so that you can partake in not just your upward adjustment, but also that extra $500 million that is earmarked for exceptional performers performing above 70. So make sure you know how to do well when it comes to quality measures. You need at least 20 eligible cases per measure. Well, if you don't have those 20 eligible cases, the maximum number of points you can actually score is 3 points. Each measure, for the most part, is eligible for 10 points. So if you're not getting 20 cases per measure, all you can do is get 3 points. It's also important to remember that you don't pick measures without benchmarks. Most of the benchmarks for these quality measures were derived from PQRS data taken from 2015. So you can actually check out the benchmarks on the CMS website and make sure that you're picking those measures that have established benchmarks so that you can get the highest number of points possible, which is 10 points. You should always have more than 6 measures ready to submit. You're not going to get penalized for submitting more than those 6 measures. Through Modernizing Medicine, most of our clients in prior years have submitted 9 measures or more. Picking high priority measures like closing the referral loop or documenting medication in the visit gets you an extra point per measure. Outcome measures, of which there are few in orthopedics, but one that might be of interest to orthopedic surgeons is the tracking of hemoglobin A1C, because obviously that affects our possible perioperative risk for surgical site infections. So if you choose an outcome measure, you actually get 2 extra bonus points, which is always helpful. So some of the things we built into our suite here are really aimed at making you be able to continue to be a happy physician and letting MIPS kind of be captured in the background by reducing your documentation burden. One of the ways, and we're going to demonstrate this with a live demo, is through protocols. The other we refer to as clipboard measures, and essentially these are measures that can be input by either the patient via a patient portal or through your MA or perhaps your physician assistant who's rooming the patient, so that these measures are captured even before you visit the patient in the examination room. We have another feature called previous findings, where previous findings are going to be pulled forward, and specifically you can pull forward your MIPS findings because there are certain measures that have to be reported, like pain assessment and follow-up at each visit. So this is just an example of the way a template was designed for protocols. And you can see, this is something that will give you the ability, literally with 1 or 2 clicks, a way to get credit for osteoarthritis assessment and follow-up. There's MIPS 128, where you essentially are looking at BMI and counseling the patient, depending if they're overweight or not, smoking cessation, and so on. You can basically customize your protocols to reflect the measures that you or your group have decided to focus on. These are the clipboard measures. This is this nice user interface that you see on your right that essentially can be input by the patient or by your MA, and things like measures for alcohol, tobacco usage, and high-risk medication usage are all being captured seamlessly in the background, giving you favorable reports for your MIPS quality measure without you having to do any extra steps. Previous findings, this is just something that's been pulled forward from a prior visit, and for something that requires a report at every visit, this is a nice feature to minimize the burden of documenting every time. So I'm going to switch here, and we're going to go to a live demonstration. So This is our user interface, and our patient today is going to be Jason Jedi, and this is a 74-year-old male who's been fighting in the galaxy and sustained an attack from the Death Sun involving his bilateral knees. He describes that pain as aching and associated with joint swelling. As you can see on this landing page, we've accounted for many things that most providers want to see immediately. One thing I'd like to point out is vitals. The reason I point that out is because one of the measures that I focus on is obesity, because as an orthopedic surgeon, tracking obesity has direct impact on hospital readmissions and infection rates and so on. So I am trying to account for the BMI measure. Under the patient clipboard, some of the nice, easy features that, again, can be captured by your MA or through the patient via the patient portal are found under social history. So I'll click on social history and go to smoking status. We'll assume that Jason Jedi is a clean Jedi and he never smokes. That's going to give us credit for our MIPS measure on tobacco usage. We also are capturing on this clipboard under social history how many times in the past 5 years has Jason Jedi drank 5 or more drinks a day. And obviously we have a pull down, but we're going to say he's clean and sober and he drinks never more than 5 drinks a day. We can pop right into the virtual exam room, and in typical fashion, you'd perform an exam. We have physical exams that document by exception. We'll say we did a comprehensive lower extremity exam. We'll say we've looked at his x-rays, and we think he has a diagnosis of knee arthritis. With the knee arthritis, he told us that he had, let's say, 5 out of 10 pain. Why is that important? Because, again, being captured in the background is one of our pain assessment and follow-up measures. So merely by documenting on this pull-down his pain intensity at every visit, we are getting favorable marks for our MIPS outcome measure, for our MIPS measure with regard to pain assessment and follow-up. I can counsel him regarding his knee arthritis, and you can see built into our counseling plan for knee arthritis and other arthritis diagnoses is MIPS measure 109. All I have to do is pull down, say that the symptoms of his osteoarthritis were assessed. I can say done and done. And now I basically have just accounted for the pain assessment and follow-up measure. I've also accounted for the obesity measure, the tobacco measure, the alcohol measure, the pain assessment and follow-up measure. Now I can leverage even farther and go right to protocols. So this is the way I've set up the protocols here, but I'd like to just comment on, with one click of a button, we can go to that obesity measure, click. It's been programmed to provide counseling, and I basically say apply selected protocol, and I can go down to the bottom, and I can see this nice history, the exam. I can see the diagnosis of knee arthritis. I have the pain intensity, which is going to give me the favorable mark for MIPS pain assessment and follow-up. I have the quality measure 109 for osteoarthritis, and then I also have the quality measure 128 for counseling and documentation regarding the patient's increased BMI. So I can save that visit note, and I can go down here to our landing page, and I can look at my PQRS measures that I just focused on. So here it is, MIPS 109, that was favorable. BMI, MIPS measure 128, favorable. Pain assessment and follow-up, 131, favorable. Tobacco use screening, which again we got via the clipboard measure. And then finally down here, measure 431, screening for alcohol usage in Jason Jedi favorable as well. So with that, I'm going to turn this over to Ida, and she's going to show you how our dashboard works.
Thank you, Jason. I'm just going to go ahead and show you from the home page. You will see a little icon for MIPS overview. Everything we just did, it got calculated from back end, and our calculation runs every night. So you don't even need to be worried about running the report or anything. Every morning you come, you just can go to your dashboard, click on the MIPS, and see your scoring. On the MIPS dashboard, you'll see 4 cards. Each one of them are identifying which module of the MIPS is getting calculated. So the portion we just talked about, it was the quality portion, which used to be PQRS. It weights 60% of your total score. So it's pretty high. We recommend you to pay attention to it starting now. You're going to have to monitor it and make sure that your score is high enough. With EMA, it's very, very simple to score a very good percentage on the quality. What I would like to highlight here is over the time, the quality percentage will go down and cost percentages would go higher. So they're kind of like a twin modules for MIPS. For 2017, as you know, cost has 0 weight. However, next year, cost going to have more weight and quality is going to have less weight until it becomes 30 and 30%. So I'm just going to go ahead and show you how does the quality get calculated. There is a percentage here that we show. This is based on what we just show you. This is based on the measures that we have selected. You do not have to have the measures we select. For this provider was, preferably selecting measure 47, 109, 130, 131, 226, and 238. However, if you don't like those measures and you wanted to select different measures, that's no problem. We can go ahead and select a different set. EMA provides a very, very large number of the measures for orthopedic providers. You can choose and select anything you want. Anything has been selected, has highlighted in green. If you don't like it, if you see your percentage is lower, it's no problem. You can uncheck that and select something else. As simple as that. And on your dashboard, you will see which measure has been selected. We calculate automatically the top 6 measures for you. Every time you see a green checkbox, that means it's calculated in your top 6. Anything you see under high priority will give you extra bonus points. As you can see over here, we have 4 extra bonuses. The very first one are included with your calculation. You have to have either 1 outcome or 1 high priority. After that, everything else is an extra bonus. So in this case, we are providing 4 extra bonuses. We also have end-to-end EHR reporting bonus. If you are submitting your data through Modernizing Medicine Registry, you are qualified for additional 6 points. This is because we just capture everything 100%, and our providers don't mix and match, or they don't, what CMS calls it cherry picking. We don't have that option. We report everything that we're capturing. If you are selecting more than 6 measures, that would be okay. And as we mentioned, we do recommend you to select more just to be on the safe side. What is really important is that for the measures you each measure you're selecting, you have to have at least 20 encounter. That means that if you are not seeing patient a measure for less than 20 encounter, it's going to get locked to 3 points. You would like to avoid that. So if you do have opportunity to report to the measures that are scoring more than 3 points, we highly recommend that. With that, I'm going to go back to our MIPS reporting, and we're going to go ahead and talk about advancing care information.
Great. Thanks, Ida. Okay. Okay, so advancing care. Many of you are very familiar with meaningful use. Here at Modernizing Medicine, we have an outstanding track record in regards to meaningful use attestation. And this is just a pie graph that looks at the major electronic health record companies, and you can see the biggest piece of the pie for meaningful use attestation. Again, this is data from dermatologists. However, it really underscores how well we are equipped for getting you to attest correctly, and obviously being the biggest piece of the pie, I think that's quite meaningful. So for advancing care, how do we get to 100 points? Well, here are just some tips to get half of those points pretty easily. Most of you are keeping a security risk analysis binder. You're used to that, monitoring the integrity and the vulnerabilities in your electronic protected health information. So that's an easy one. You have to e-prescribe at least one patient. You have to provide access to the patient portal for at least one patient. And you have to send a summary of care measure for at least one patient. So now you're halfway there. How can you get even farther? Well, we can get you to 65 points pretty quickly. So 15 more points are going to come from the following. You get an advancing care bonus of 5 points if you join a specialty registry. Here at Modernizing Medicine, we actually have 4 specialty registries that I'll mention in a future slide. So you can report using those specialty registries to get an extra 5 points. You can also get an extra 10 points for doing improvement activities through our EHR. And so there you go. You've got from 0 to 65 fairly quickly. For those 5 points in regards to specialty registries, we've basically limited it down to specialty registries that focus on acute medial meniscus tears, plantar fasciitis, low back pain, and herniated cervical discs. If you don't want to report through our specialized registry, you can still get those 5 points by reporting to a public health registry or a clinical data registry. So with that, I'm going to turn the controls back over to Ida, and we're going to talk about how we do advancing care on our dashboard.
Thank you. So I'm just going to go ahead and click on advancing care information so you can see that how the data is getting calculated. Again, this is 25% of your total score. This section is what it used to be meaningful use. Majority of you are already familiar with these measures. Meaningful use modified stage 2 used to be 10 measures. And that has been reduced to only 6 measures. And even within the 6 measures, it's even simpler because you only need to report certain measures that you're doing really performing well on it. Your score contains of 3 sections. There's a base score, there's a performance score, and there is an extra bonus, as Jordan, as we just went through it. I'm going to talk about the basis score. Basis score is just 4 measures. So you need to do very, very minimum with those 4 measures. Only one instance of the scenario would give you extra credit. Over here, this provider has done really well. So he has done at least one scenario for electronic prescription, patient access, which is our patient portal, and health information exchange. And as we just mentioned, protect patient health information. So protect patient health information is just a yes and no question. This is something you're already familiar with, you're already doing with meaningful use. I'm just going to go ahead and select no on this and show you what happened to your score. So if you do not meet the requirement for these 4 measures, your score is going to go back to zero. You will not be able to report anything on it. So it is required for you to do at least minimum of those 4 cases. I'm just going to go ahead and select yes, and I'm going to update the scores. After that is electronic prescription or e-prescription. With EMA, it's really, really simple. Majority of our providers do at least 99% of their prescription through e-prescribing. We are certified with SureScript. It's certified not only on the web, but also on the iPad and even on the iPhone. I'm just going to go ahead quickly show you how simple it is to send the e-prescription and get credit for this. There is a ERX waiting for me. I'm pretending I'm a provider, and this is the prescription. I'm going to select it. I'm going to do e-prescribe, and it asked me to select a pharmacy. I'm going to select my favorite pharmacy, which is MU. And select anything you want, and then select the prescription, and you're done. The prescription has gone, and you have got credit for this measure. Very simple. So next one that is also very, very simple, not only give you credit for patient access, but also it's giving you credit for specific education for the patient education. So it's giving you credit for one action you take, you get credit for 2 measures here. And it's very, very simple to activate patient portal. We highly recommend our providers to do that on a daily basis. Therefore, the more you do, the better it is. The only difference between a portal measure and then a specific education is that the portal one, you need to activate it within 4 days, versus the education, it doesn't matter when you activate it. Whenever you're activating, you get credit for it. I'm just going to go ahead and show you how simple it is to activate the patient portal. I'm just going to grab Jason's patient, and I'm going to go ahead and show you. Here it says, right on the top, it says patient portal is inactive. I'm going to activate it. All you have to do is just provide an email address and a username, and you're done, and enable it. And that's it. You're going to get credit for 4 measures now. Next one is a little more tricky. So health information exchange, it's been a challenge for some of the providers. The tricky part is that you really need to send your CCD files to another provider. What does it really mean? Everybody asks me, why do I need to do that? Is that when you're referring a patient to another provider, you are sending patient information electronically and securely to that provider. And what CCD stands for is that it's basically sending all this information in the computer language. So the other provider can read, if they have a certified EHR, they can download it and see what you exactly have been communicating or you are meant to communicate. Just going to go ahead and show you how EMA does it. It's pretty simple. I'm just going to go ahead and click on it right inside my ACI page. It's telling me that I have referred the patient, but I have not sent the file to the other provider. Just going to go ahead and select on it, and I'm going to find my finalized visits. And this is a PDF format, and here it is. This is the CCD file, which I mentioned. It's the electronic version of your visit notes. So I'm just going to go ahead and send the CCD. I'm just going to put a provider's address, and it automatically comes into your pull-down. You can build your own favorite contact list. I'm testing it, and I'm just going to go ahead and send it, and with that, you automatically got credit for this measure as well. The other areas that you want to do, so with these 4 areas, I've already got my basis score, which is 50. And again, you only need to do this once during the reporting period. But once you achieve that, then everything else is become percentage. You're getting, the more you do, the better score you're going to get. With our system, again, with the patient portal, you can get credit for 2 of them. It's very easy to score 90% of your patients with the portal. View, download, or transmit is a little more tricky because you don't have control over your patients. You can't force them really to log into your portal. So if you do have the active patients would like to, log in, they see, sometimes, we do have some providers that they actually ask the patient or teach them in the office how to log in, and that would give them automatically credit. We spoke about the patient-specific education. Secure messaging is what we call intramail. This is when you are communicating to your patient through EMA. And again, it's very, very simple, just like an email, you're sending it through EMA. It was nice to see you, don't forget your medication, or, as simple as that, and you get credit for it. Then it's medication reconciliation. This is really, really simple with EMA. We have built a feature in EMA which uses short script data. All you have to do is just go to your clipboard and try to bring the medication into the system. So every single medication that has been recorded in short script will appear here. I'm just going to go ahead and show you quickly that how simple it is. I'm going to look at this patient, and I'm going to go to the clipboard and medication. I think Jason already went through this program with you, but we didn't show you how simple it is with the medication reconciliation. So all you have to do, just import pharmacy fill history, and you'll be done. It's just one click, and you're going to get credit for the measure. With that, I think we almost cover all the main measures. I haven't covered the bonus. We spoke about our registry. Again, it's very, very simple. All you have to do with the registry, just select the registry is from Modernizing Medicine specialized registry that you wanted to participate. It's just a few clicks, and you automatically get 5% of your bonus. And now, if you decided not to go with our selection, you do have other selection. We have syndromic, we support cancer, which is like very, very few vendors actually supporting cancer. We are one of them. We're supporting it in majority of the states. And then if you again, this is 5%, and there's another 10% which comes from improvement activities. We're just going to quickly go through this slide and show you what are the improvement activities, and then I come back and show you what EMA can offer.
Great, thank you. Okay, so improvement activities, the last component we're going to cover. So this is really dictated by your group size. And the way things are defined, you are a small group if you are 15 or fewer providers. You'll need 2 medium measures and 1 high-weighted activity. If you're a large group, meaning 16 or more providers, you'll need 4 medium measures and 1 high-weighted activity. It's important to remember that improvement activities can't be repeated year after year. You should only submit the required amount of information for your improvement activity for the given measurement year, because when the following year comes, you'll need to pick a different activity. Find bonus points. Okay, Ida and I mentioned the specialty registries. That's going to give you 5 points through our product. Clinical improvement activity bonus points. You can get those with expanded practice access, structured medication reviews, closing the referral loop, or the enhanced patient portal that Ida just touched on. What are some other ways to quickly get to bonus points? So end-to-end reporting, 1 point per quality measure. What about the high priority measures? Carefully choose those, but if you're going to choose them, why not pick the high priority ones, like a falls risk assessment or a falls plan of care, or easily documenting the medications in the medical record. Outcome measures, you get 2 points, and I think, again, a very pertinent one for orthopedic surgeons is the hemoglobin A1C because of its implications for perioperative risk and readmission. So all of these together really add up fairly quickly to almost 27 points. So I'm going to turn the controls for the last time back over to Ida, and we're going to see improvement activities.
All right, let's go back to our dashboard, and here we are, improvement activities. CMS has published about 93 options. We have incorporated all 93 of them inside EMA. Not all of them are doable through EMA, so however, we do have option. If you decided to use another system outside and just select something else, you can go ahead and select those. There's a good portion of them are supported by Modernizing Medicine and EMA. We have listed it in the top. I'm just going to go quickly through them and show you how simple it is to gain your scores for this section. For improvement activity, there's 2 options for you, and it depends on the size of your practice. So if you consider small size, that means that you have less than 15 providers in your practice. If you are 15 or higher, you consider a large practice, and in that case, you do need to go to the 40 points. However, if you're a small size, you only need 20 points. So by saying that, there is a different weights on the improvement activities. Some of them are medium, some of them are high. So the medium activities consider 10 points, and the high ones are 20 points. So if you belong to the large practice, you need at least 1 high and 2 mediums, or 4 mediums. And if you belong to the small practices, you only need 2 mediums. So I'm just going to go ahead and quickly show you how to select those. Patient portal, as we've covered over and over, is a medium weighted, and if you select that, you also get the extra 10%, which I'll show you in a previous page. Anything has the green checkbox will give you extra 10%. If you are using ACI and you activating patient portal and you actively using patient portal, that's a very easy measure to select. The other measures that we do like and we highly recommend is medication reconciliation. I just show you how easy it is to use. We do have other options. My very favorite one is 24/7 submission. 24/7, you either can use our intramail if you communicating after hours, like after 5 p.m. or during the weekend. If you can show, you've been in contact with your patient after hours, that you can get credit for that. Or if you have a call center in your practice, that would also make you qualify for this measure. And why is it my very favorite one? Because it's high. So if you are small practices, all you need is just a call center or using EMA's intramail, and you're all done. We did talk about slightly about our specialized registry. If you register with our specialized registry, you also are qualified for the population management measure. As you can see right here, I have selected 1 high, and I'm just going to go ahead and select 2 mediums and save the selections. And with that, my score is up to 40. I'm going to go back to my MIPS reporting, and in this case, with all the measures we went through, the score of this provider is 91.38%. We think it's very, very simple with EMA to score high in MIPS, so we recommend you to if you're using EMA, definitely report for full calendar year. You do have options of reporting as minimum as only one quality measure and prevent penalty, or just 90 days on all three of them and gain incentive. And if you're reporting on all three areas for full calendar year, you get a very, very large incentive. So we don't know what is that number yet, but it all depends how many people participating on the MIPS and a lot of other factors.
Fantastic. Okay. So, here at Modernizing Medicine, as Ida and I have covered today, our goal really is to enable you to continue enjoying medicine. Obviously, these government-mandated MIPS requirements can seem like a headache, but here at Modernizing Medicine, we've really tried our best to make the capturing of these components fairly easy and integrated into our system so that you can continue to enjoy the practice of medicine. We offer two different programs. One is called MIPS Assistance, and that's through our ModMed pledge, and through that program you pay a small nominal fee to basically work with somebody to guarantee that there is no negative adjustment of your Medicare payments. There's the VIP premium advising option, which essentially enables you to have a very interactive and very comprehensive experience with one of our expert advisors to make sure that you're an exceptional performer. And again, that's a score of 70% or higher. This is just a reference. Some of the points from this talk came from the CMS website. I encourage you to go to the website under the Quality Payment Program at cms.gov, and you'll get a lot of information regarding your quality measures. And I think it was helpful for me when I had to choose which quality measures to focus on as an orthopedic surgeon. You can also go to the ACS, American College of Surgeons website, and get more information there. So for more information, you can go to our website. You can look at our ModMed pledge. And with that, we thank you very much for your time and wish you a good afternoon.